Hi everyone, today's video is about signs and symptoms of endometriosis. But before moving to the signs and symptoms, let's talk about what is endometriosis. Let us know what is endometriosis. So endometriosis is a gynecological condition involving presence of endometrial tissue or endometrial mucosa in abnormal locations. So basically, this endometrial tissue should be on the inside of the uterus. That is, the endometrium is the inner lining of the uterus. This is where that endometrial tissue should be located. But in endometriosis, this endometrial tissue is in places where it shouldn't be. That is, it is outside of the uterus, in places like surrounding structures on the fallopian tubes or on the ovaries or even in the other parts of the body. So, it is this tissue that is outside the uterus. Now, this endometriosis condition is relatively common and it can affect approximately 10 to 15% of reproductive aged women. And the important point here to make a note of it is approximately one third of the patients with endometriosis are asymptomatic. That is, they don't have any symptoms. So let's move on to the signs and symptoms of endometriosis. So in patients who do experience symptoms, one of the biggest symptom is they are going to experience is pelvic pain. So it's going to be pain in the pelvic area, and this pain is going to have a characteristic feature about it in that the pain intensity fluctuates throughout the menstrual cycle. So the reason this happens is because endometrial cells in this endometrial tissue that is in different places in the body, it itself responds to changes in hormonal levels during the cycle. So what is often found here is that the pain is going to be worse at the onset of menstruation. Now, this pain doesn't only have to be located in the pelvis, it can be found in other parts of the body as well. Some of these parts of the body that can experience pain include the lower back, the lower abdomen, and groin. These are going to be very common parts of the body that can also experience pain. As we mentioned before, this endometrial tissue can be in different surrounding structures in the pelvis and lower abdomen, which can cause us pain. And then again, the location of the pain depends on the location of the abnormal endometrial tissue. And like the pelvic pain, this other pain can fluctuate during the cycle. So pain is often going to be worse 2 to 3 days prior to menstruation onset, and then it typically improves, goes within 1 to 2 days of menstruation. So again, pain will be worse at the onset of menstruation. So this is going to be the typical pattern of pain, and what will often be noted is that this pain can often get worse over the time. So another very important symptom of endometriosis is going to be what we call dysmenorrhea. Dysmenorrhea is going to be a painful menstruation or painful period, and it's going to be severe. So patients can often have intense pain and cramping, may worse over time with each subsequent menstrual cycle along with other bodily pain. That is, it is progressive type of pain, meaning that over time with each menstrual cycle the pain will get worse and worse and worse. We often see a potential sign of endometriosis is menorrhagia. So menorrhagia is going to be heavy bleeding during menstruation. So it will be heavy bleeding or can be prolonged menstruation, which means it's going to be longer than 7 days. So it's usually 8 days or longer. And then what can also be noted is that bleeding can be irregular. Another symptom of endometriosis is what we call dyspareunia. Dyspareunia is pain during intercourse. Now, this is actually relatively common symptom of endometriosis, and we can also see dyschezia occurring in endometriosis patients as well. This is essentially constipation, so it's more specifically difficulty defecating. So there is pain during defecation or trouble or issues with defecating. We can also see urinary symptoms occurring as well. So let's move on to homeopathic mode of treatment for endometriosis. Homeopathy offers natural and safe management of endometriosis, and homeopathy medicines have no side effects. They help prevent further progression of the disease. The first drug of choice is simicifuga. This medicine is well indicated where there is ovarian neuralgia and pain radiates upward and downward up to anterior thigh. Menses are profuse, dark and coagulated, pain radiating from hip to hip across the pelvic region. Simicifuga can be taken in 200 potency every alternate day, daily one time. Next is xanthozylum. This remedy is useful where there is neuralgic dysmenorrhea. Menses in this are too early, painful, thick and almost black. Leukorrhea at the time of menses. The symptoms are worse on the left side. Next is sepia. Sepia can be thought of when patient feels a bearing down sensation as if everything will fall off through the vulva. Here there is a painful intercourse and sometimes menses are too late and scanty or too early and profuse. Next drug is platina. Platina, this remedy is indicated where menses are too early, profuse and dark clotted with hypersensitiveness of the parts. Nymphomania is present, ovaritis with sterility. The last is sabina. Sabina is of great help where there is a pain from the sacral region to the pubic region and from below upward. Menses are bright red and clotted and worse from the least motion. Discharge of blood between menses with nymphomania with a tendency of threatened abortion. So in conclusion, homeopathy offers a holistic approach to treating endometriosis. So friends, I hope you like my video. Please do like and share this video with your friends and family and do subscribe to my channel. Thank you so much for watching my video. See you in the next video.